What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. As usual, I am your host, Dr. Meghna Dassani. Today, I have a dentist that I greatly admire. And if she didn't live so far away, I know I would be hanging out with her all day, every day. I want you guys to meet Dr. Amanda Sharp, and she practices in Florida. Welcome, Amanda. How are you?
Good. Thank you for having me.
It is such a pleasure. I know we've been talking about doing this for, I don't know how long. And then life happens between your kids and mine and our practices. And well, we're here finally. So just for our listeners, you are a general dentist, just as I am. We both still love teeth, but sleep is a very big part of your practice as well. Is that correct?
Absolutely. Yeah, it has become a big focus and a big even screening for all of our patients, new patients, existing patients, and has just become part of our everyday practice now at this point.
Yeah. How did you kind of fall into that? Or what happened to where you realized that this was important and you wanted to make it such a big part of the practice?
So I remember when I first bought my practice and I'm looking, the big thing for me was I was making a ton of night guards. So I'm like, oh my gosh. And I was trying to figure out for myself so I could be a better dentist. Why are so many patients clenching and grinding and breaking their teeth and recession and have fractions, notchings in their teeth? And I'm like, is everyone just severe clenchers and grinders, or is there more to this? Because this is crazy. So we're making a ton of night guards and not really diving much further into it than just to protect the teeth. And so I started doing my own research on what else could be causing clenching and grinding. And then I got into this, started looking at the sleep stuff, learning more about how poor sleep or deficiencies in our sleep or oxygen deficiencies or sleep apnea could lead to clenching and grinding. That was the initial, okay, maybe I'm missing some signs and symptoms of something bigger in my patients, more than just a tooth problem. And I wanted to make sure I was doing right by my patients and not missing something that's jumping out at me that I see every day. And so it started with that. And then it went to, from there, not just adults, but kids are also clenching and grinding. Why am I seeing this on kids? So it definitely was a spiral effect. Me and my team together, once we learned one thing, then it went to the next thing. We wanted to learn more about it. And that's kind of where it started.
Yeah, I love it. I love it because I'm always, telling our listeners and even doctors, when we have these conversations, you always ask why is this happening? And then you go down a further rabbit hole and ask that second why. But why? You almost want to be the 2-year-old, the toddler that goes, why for everything? But it does lead us to answer. So I love it. How about we give our listeners an overview? And you kind of briefly touched upon it, dentistry, how dentistry plays into treating sleep disorders, and where does that overlap and the interaction happen? So what are the signs and symptoms that you were noticing other than the clenching and the grinding?
Yep. Clenching and grinding. Yep. And then so for adults, for example, looking in the mouth and just seeing that some of these things were all correlating together, that, okay, they're clenching and grinding, but they have a very narrow mouth, or they had teeth extracted when they were kids, and that now they have a very small upper jaw and lower jaw trying to come together, and their tongue looks like it's way too big to fit in this little tiny space. So those were some of the things that and then as we started realizing what we're looking for in the mouth, sometimes we start to see that the tongue's really restricted. They're breathing through their mouth even during the exam. My mirror's fogging up constantly because they can't breathe through their nose. And then from there, when we started seeing all of these signs and symptoms in the mouth, that's when we started implementing, well, let's have them fill out a form about how are they sleeping. And so almost all these patients were seeing issues in the mouth and signs and symptoms of the mouth of something going on. They're checking a lot of boxes on the sleep questions too. And so that's where those two, you start to see this come together and see how what we could see visually during an exam may equal exactly what their symptoms are, or maybe things they didn't even know were an issue while they're sleeping.
Yeah, it's so fascinating. The more you dig, the more answers you get. And even with our patients, I remember for me, it was like one of the biggest ahas I had was when I was speaking to a cardiologist that, we worked with very closely. And he's like, Well, I hope you do know when you have a patient that needs more than one drug, is on 2 or more drugs to control their hypertension, you need to be looking at sleep. And I was like, oh my gosh, this is something I can actually screen these patients for. And I know you have a ton of these conversations as well. So let's dive a little bit into health implications that as a dentist, you are noticing in your patients that helps you connect the dots with what's going on with their sleep.
As far as what other like major medical things we're seeing?
Yeah.
So yeah, heart problems, hypertension, heart issues. For us, we're always talking to them about they're a high risk for stroke because of the lack of oxygen while they're sleeping. Acid reflux, that's a common question or common ask in our talks with patients or meetings with patients. You suffer from acid reflux. We're always asking about chronic allergies or sinus issues. For kids, ear infections, or strep throat frequently, tubes in the ears. So yeah, all of those kind of health things that we try to pull back to. And also, we ask a lot about, a lot of patients are in sleep pills too, to go to bed at night and to help them sleep at night and stay asleep at night. Anxiety and depression as well. We'll see that as sometimes linked in with sleep apnea patients.
Yeah. So much that is interconnected. And for the longest time, I've been to dental school twice. We were taught you just fix teeth, and it's so much more that, it impacts what we do and how we can help our patients. Common signs and symptoms. What should patients be looking for in themselves, their loved ones, and even their kids? What can they notice that can spark I better ask about this? What are the signs and symptoms that you talk about with your patients?
Yeah. So starting with kiddos, this is the same for adults too. One of our first questions is always about snoring. Do you notice snoring? For kids, we focus a lot on snoring, restless sleep, bedwetting with the kiddos, waking up throughout the night. Of course, any choking, gasping for air. We also get into speech issues, speech therapy issues, behavioral issues, trouble concentrating, ADHD symptoms, especially with the kiddos. Because what we find, and I guess also research shows, if kids act different than adults when they're overtired or they're not sleeping well or they don't get oxygen at night, where they might act more out of line and might have more ADHD symptoms, where adults might just feel this chronic fatigue and tiredness throughout the day. So for our adults, we kind of switch it to the conversation of, how do you feel so we ask about snoring. We ask about, has your partner heard you gasping for air, choking? Do you wake up throughout the night? Do you use the restroom in the middle of the night multiple times? How do you fall asleep? Do you stay asleep throughout the night? When you wake up and you've slept for 9 hours, how do you feel? Do you feel great and well rested and you're ready to go? Are you still just extremely exhausted? Do you breathe well through your nose? Do you feel chronic congestion in your nose, which is very common? We see that all the time. Those are kind of our baseline, and usually multiple things are yes.
And those are red flags, right? Where you're,
yes,
hey, this might warrant a bigger, longer, more in-depth conversation. What is usually the next step for these patients? What do you recommend?
So for the adults, if they start checking the box for sometimes even one thing, sometimes it's just snoring, because sometimes they may not realize how tired they even feel or how much it is interrupting their sleep, but their wife's complaining they're snoring. So even if it's one thing, but especially if it's 2, 3, 4, 5 things, the first thing we recommend is a sleep study to get a diagnosis. We don't know what we're dealing with, but we're trying to treat if we don't have a diagnosis. So we want a sleep study on all of our adults, especially. And then we always scan their airway and we look and see, do we have it? What is our obstruction back there? What size volume of airway are we working with? Do we have nasal obstruction that we need to get another specialist or another medical doctor involved with their treatment? And then also with this, the sleep study gives us information on, is this something we can help them in our office? Do they need a CPAP or something outside of our office that we need to get them in with a medical doctor or sleep physician? With the kids, the first thing we do is we also like a scan of their airway, because for me, the big thing it shows me is their adenoids and their tonsils, and I can see really well if I need to start getting them in with an ENT to look at that, and if we need to get another provider. And then looking also with a scan at the size of their arches and if they're on track for optimal growth and development. And do we need to intervene at this stage to get them on track, so that we can hopefully prevent future sleep issues in these little ones too?
Yeah. And a lot of these adults, especially, when we get pushback, and this is exactly what I tell them. Yes, you don't feel tired or you don't feel any different, but that's a lot of times that's their baseline. They don't know any better. They don't know what it might feel to actually be rested. So if being tired is your normal and you haven't known anything better, that's where you are. And it's the same thing with the kids. And I know you see a ton of kids as well. What are some of the complaints, or what brings parents? I know you have parents drive a ways to come see you, to bring you their children. What are the common complaints that these moms or dads present with when they're bringing their kids in?
So it can range. A lot are sleep complaints. A lot are snoring or restless sleep or tiredness. I had one this week with behavioral issues that also associated with snoring and gasping for air at night. So it can range from sleep stuff. So we do see sleep stuff. On the other hand, I get a lot of parents calling us because they're noticing crowding. The parents notice their jaws look too small, that they don't have enough room for their adult teeth. That we had one the other day, the mom noticed the kid's protruding his mandible forward all the time, moving his lower jaw forward, trying to breathe. So she, parents just they're paying attention to their kids, and they're realizing they're kind of doing a little bit of their own research and realizing, I don't think we're on the right track with where we need to be, and that we're going to have enough room for these teeth. So I do get a lot, even just looking at the parents looking at crowding and not liking that and not wanting to make enough room for those adult teeth. And so it's a lot of times may start there, and then we start diving into more of the sleep questions, and they may have not even realized or connected the dots or have been asked about some of these sleep issues. And then we're relating it back to what we're seeing in the mouth and the crowding, and the poor tongue posture, the low sitting tongue, and how that all kind of plays a role in the cycle.
Yeah, because you mentioned that, and I was waiting for the right point to segue to that. Let's talk about the tongue and low tongue posture. How does that impact sleep, or what is the overall implications for, say, when you do see a child with that low tongue posture or mouth breathing, or just sitting there with your mouth open, right? Talk to me more about that. Let's get into the details.
Yeah, as I explain to parents all the time, where I want that tongue to be sitting is on the roof of the mouth. Ideally, you want the roof of the mouth at the end of growth to be basically the shape of your tongue. That tongue has formed the whole roof of the mouth. So it's nice and broad and wide palate for that tongue, for that resting spot for the tongue. So if we have a tongue tie, or we have a really restricted tongue, or again, a kiddo I saw maybe last week that his adenoids were so large that he literally could not breathe through his nose. So he's open mouth all the time, and his tongue has gotten used to just sitting really low in his mouth because it can't go to the palate when he has to breathe through his mouth, right? So it's gotten used to, he's a really poor tongue tone and poor tongue posture. And so what's happened to his palate is it's come up like this. It's V shaped. So it's very narrow, but it's also very high arch and the tongue can't sit up there. So it's sitting way down. And then at night, instead of resting on the palate, it falls back more into our airway, into our breathing space. So in kids or adults like that, we're trying to not just make more room for the tongue, but we also need to retrain that tongue where to go once we've made room for it. So because it's a big muscle, it needs to be exercised and put in the proper position. So it is muscle memory at that point on where it needs to go.
Yeah. So that leads us into myofunctional therapy, where you mentioned, the tongue needs to be trained. Now, do I have this right? You do have a team member that is on board that is trained as a myofunctional therapist. Is that correct?
Yep. My hygienist, who's done a lot of sleep training with me. So she knows all about the sleep issues and the sleep apnea stuff. And then she went on and did myofunctional training. So she sees our adults and kids for myo.
Perfect. And that's exactly how our practice is set up as well. What does that look like for those patients, adults or children? What do those appointments look like? How frequently are they seen? Where does all of that tie in with appliance therapy that you may be doing for these adults or children?
So, yeah, good question. We, depending on, I guess, adult or kid, no matter what, sometimes we need to, with the kids, we do need to start widening their arches a little bit before we can do, say, a tongue tie release, but we almost always are starting them in myo the same time we're making the appliance. Because even if there's so many different parts of myo, sometimes she's working on them with nasal breathing. Sometimes it's lip seal and lip closure. Sometimes it's tongue positioning and getting the tongue to the roof of the mouth and swallow patterns. So even if we're waiting for an appliance to give us room for our tongue on the palate, she's working on other aspects of the oral facial muscles with them. So how it works is usually I see them first and do a consultation on what are we dealing with? What's the diagnosis? Where are we going from here? What appliance do we need? And then she'll see them and do her myo assessment, which is about an hour and a half assessment where she does a lot of it. She watches them eat. She has them do different exercises to see where how the tongue, cheek, lips, everything's working together, and comes up with a game plan. Usually she'll start them at 12 sessions. Some are more, some are less. She sees them once a week, some in person, some via video call like this, and just kind of depending on how much they need to see in person what she's doing. And she goes over exercises with them and how to get those muscles working together properly, and gives them kind of homework to do. So every night they have 10 to 15 minutes of exercises that they do in between their weekly sessions with her. And then she sees them for about 10 to 15 minutes for a weekly session, to go over the next set of exercises and how things worked that week. And are they getting the results they want from that week, or do they need to go back a step and maybe do something different? So
yeah, lots of moving parts and pieces. So with all of this, how are you educating your patients about the importance of sleep hygiene, right? Proper sleep hygiene, because this does impact effectiveness of treatment, how effective it is. What are the conversations? What do these conversations look like?
So that's part of when we are doing any appliance, adult and kids. Yeah, that's part of the things we talk about, and what some of the handouts we even give them on what we want them to do for sleep hygiene. Some of it depends on if it's an adult and on their sleep study, if they had, for example, a different position that they were less apneic in, or they need to sleep on one side versus another side. Some of it they're super congested, and every night they need to do nasal sprays, or X-Clear, xylitol sprays every night and clear things out, or take a warm shower and really blow your nose after, and use nasal strips or use nasal cones. So we do a lot of that, kind of depending on what their symptoms are, and is it a nasal thing? And making sure also, but they're a lot of people on screens right before bed too. So going through that they're doing the right, hey, we're not having, caffeine after this time, and we're putting away the screens an hour before bed, and we're reading a book or whatever they may do before bed, to get into the sleep routine and establish good habits.
Yeah, those phones are so important, especially for the kids, right? I know both my girls are like, oh, we're going to watch TikTok until we get sleepy and fall asleep. I was like, that's not how it works. You got to put that screen down. Yep. It's become so, it's almost become one of those conversations that patients don't want to have with us, but they're so important, where it's like, okay, no alcohol right before bed. I know you think it makes you sleepy, but it impacts the quality of sleep you're going to get.
Yeah.
Super, super important. As we wrap up, what are your top 3 tips for parents? Let's focus on parents first, because they're the ones that are bringing us their kids, and a lot of it applies to them as well. Top 3 tips for parents as they are navigating this world of, does my child have a sleep issue, or who do I see? When do I see them? What is your advice?
So, if you have a kiddo who is snoring, or you hear them stop, especially if you hear them stop breathing, gasping for air, choking, of course you want to bring it up with your primary care. But if you're not getting anywhere with that, or you're not really getting too far with primary care, ENTs are a great resource as well. But from there, finding someone who will look and check tonsils and adenoids. We have inflammation of the tonsils and adenoids that are causing an obstruction It just looking at your kid, how do they look like they're extremely crowded and narrow jaw that someone needs to step in and intervene and help give them some growth and development. And then number two, are they breathing through their nose? Or are they breathing through their mouth a lot? Are they sitting there watching TV or reading a book and their mouth is wide open? When they're sleeping, is their mouth open? Or do they look like they're comfortably breathing through their nose? So those are kind of the three big things I would look for. Number one, to see if you need to get another professional involved in their care.
Yeah, it's as I say, listen to your instinct. You are the parent for a reason. If you aren't quite satisfied with the answers you're getting, ask more questions or go get a second or a third or a fourth or whatever opinion. But there's always an answer, right? That's the reason you and I got into this.
And I'm sure you're the same too, but I can't tell you how many parents we see, because we're usually not the first healthcare professional they've called, because they've already met with 4 or 5 healthcare professionals explaining their concerns, and they get a lot of, it's normal, they're fine, they'll grow out of it, that kind of stuff. And these parents know their kids, they know something's not right. And so they are the ones who keep pushing for answers. And like I said, we're usually the 4th, 5th, 6th healthcare provider that they've seen, trying to figure out what they can do to help their kiddo.
Yeah. Wow. Lots of amazing information today. Before we let you go, how can our listeners find you?
So I'm a general dentist in Bradenton, Florida. Our office is Manatee Family Dental. That's our office website, manateefamilydental.com. And also on our Facebook is Manatee Family Dental as well.
Perfect. So for our listeners that are tuning in, if you are in Florida, which I know we have a ton of people, or you have loved ones in Florida that are looking for answers for dentists that actually will listen. And if she doesn't know what to do, I know she will find out. Dr. Amanda Sharp is your person to go to. Thank you so much for taking the time today and chatting with us.
Thank you for
as
having
always,
me.
Yes, it was such a pleasure. As always, don't forget to share this episode, leave a review, and I will see everybody next time.